Hello, everybody. It's my honor and my pleasure to discuss the situation of coronavirus disease. Okay, with you over the long distance. Okay, I personally am the general director of Guangzhou Health Commission. Also, I'm also a doctor for infectious diseases. On behalf of our Mayor Wen, I'm going to introduce the coronavirus disease epidemic and epidemic prevention and control in Guangzhou. Okay, my presentation will be divided into 4 parts. Okay, the first part is the overview of Guangzhou. The second is the current situation. The third is the major challenges, and the fourth one is the contaminant efforts. Next, next, please. Okay. 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 Guangzhou is one of the biggest cities in South China. Okay, with the population of 22 million. Okay. Next, please. Next page. Next page. Okay. 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 We had the first imported cases from Wuhan, Hubei. The first imported cases was identified in January 21st. As of March 24th, 388 cases have been confirmed. 337 patients have been discharged up to now. And we had one patient dead, okay? So the cure rate is 87% up to now. The case fatality in Guangzhou is 0.26%. Okay, as you can see from the, maybe not very clearly, okay, from this chart, okay. We're now facing the challenge. Okay, actually, you know, the domestic cases have all been cured, and now we are facing the great challenge from the imported cases from overseas. Okay, up to now we have been reported more than 40 imported cases from all over the world. Okay. Okay. The major challenge is we need to prevent the imported cases from overseas, and to contain the spreading in the communities. Okay. So actually, what we have done, the measures we have been taken includes, okay, next, please. We think the early detection, early report, and early isolation and early diagnosis is very, very important. Okay. Also, for the patient's treatment, we centralized the patient's treatment in dedicated facilities, okay, by senior medical professionals for all over the city and with necessary resources. Also, we suggest the coordination at different levels of authorities and society-wide efforts to prevent and control the pandemic. Okay. Our experience includes 5 parts. The first part, I think the most important thing is the leadership. The strong leadership, strong government leadership is very, very important, okay? According to the different situation, Guangzhou government has issued 4 notices. Different notices, okay, we have different measures to take, okay? For example, on 23rd of January, we activate the level 1 public health emergency response, okay? According to this response, we close all the public places. We take strict temperature taken in the railway station, subway station, and bus station, and in many public places, also including in communities. And we stop the enterprises, okay, operation, and this and postpone the school terms, okay? And for example, another example is the day 2 days before, we had the 7th notice, the government notice, okay? And according to this notice, all travelers arriving in Guangzhou should self-quarantine at home or quarantine at designated facilities for 14 days. You know, Guangzhou is a transportation hub in China, okay? We have more than 5,000 passengers coming into the city or passing through the city. So it's a big burden for us. So we open a lot of hotels and a lot of, okay, to accommodate these passengers. So this is the first part. I think the strong leadership, government leadership is this powerful leadership is very, very important. The second is the community participation, okay? So the third one is the science-based measure taken differentially. Okay, for example, we maintain the joint transport checkpoints, we tighten community prevention and containment, we reinforce the role of medical facilities, we adjust the public health emergency response, conduct region-specific multi-level targeted pandemic prevention and control, okay, and so on. Okay, the fourth part is the central is to centralize all resources for treatment. Okay, we desegregate 13 hospitals in the city for hospitalize all the coronavirus patients. Okay, and also we dedicate the resources to the designated hospital. For example, we connect all the ICU experts from the other hospitals to the designated hospital to have group consultations every day for rescue the severe patients. The fourth one, I think, the fifth one, I think, is the open and transparent and educational publicity is very important. Okay, so the general public is always being kept aware of regional cases distribution and the treatment outcome by daily updates. Okay, so as the Director General of the Health Commission, we have issued a series of guidelines for the public to obey. So, for example, during the peak of the epidemic, most citizens they by themselves they don't want to go to outside. They just obey the rule, obey the regulations. So I think the public's cooperation is also very important to control, to prevent the epidemic of these diseases. So finally, I'd like to, as my language is not good enough, I hope you can understand what I have said by looking into the slides, okay? I hope we can contribute, to whatever you hope to us to do, in Guangzhou. As this movement, because the burden in Guangzhou is relatively lighter than maybe in your cities, in Europe. Thank you very much.
Thank you very